Having healthcare providers have access to as much information as they can about what's happened to you, no matter where it happened, is beneficial.
This is a great place to be sick.
We had some real pioneers of electronic medical records. Dr. Clem McDonald is kind of one of like the George Washington of electronic medical records, along with Bill Tierney, along with Mark Overhage. Whenever you look at the literature on the use of electronic health information, they are truly some of the world's experts and pioneers.
IHIE, the Indiana Health Information Exchange, has been around for a long time, brought together by the 5 charter members, acknowledging that there was value in having available to a physician who's treating a patient all of the information about that patient's care, regardless of where the patient had been treated.
The value that IHIE has is what we call the Indiana Network on Patient Care, INPC, and that is the big database.
Well, it's the most comprehensive clinical repository in the nation. So the object is to improve care.
We're in the emergency department at Wishart Hospital, and so there's many ways that a patient can come into the emergency department. And so the front door, about 75% of our patients come through here, and they'll check in at a registration desk. So the other way is the ambulance entrance. Essentially what happens is that there's a registration event. They want your insurance information, they want to know your address. That system sends a message to the exchange that you're now a patient at Wishart Hospital. So 3 things have to happen. You as a patient have to be here, I have to be a physician working here, and the workstation we're using has to be known as a Wishart workstation. I think the clinical benefits are extremely clear to us in the emergency department. If you get injured and end up in an emergency department, how long do you want the emergency department to wait to have access to your medical record? This patient has data from both Wishart and Clarion, and so when the patient checks into the emergency department, this automatically gets printed out within 30 seconds of the visit.
It's interesting the way this grew up in Indiana. We are generally a sharing culture, and we're willing to put patients first. And that's the basis upon which IHIE was formed.
This is a community with very strong leadership. It's why things work here so well. Strong collaborative leadership. Hospital corporations that were well led by visionary CEOs at that time. So the collaboration has turned out to be a really good business decision on their part, because they all need to be sharing information in a porous system, which is what the Accountable Care Organization and Network is likely to be all about.
The government has created accountable care organizations where we are each going to undertake some risk for delivering complete care to patients. One of the things that IHIE provides is an opportunity for us to know, when did one of our patients get treated at another institution?
With accountable care organizations, an organization can be held responsible for a cohort of patients without an enrollment process. So an HIE, a health information exchange, might be vital to the success of this prominent health reform initiative. IHIE first started with clinical messaging. So clinical messaging is a simple service. It takes a lab result from a hospital and transmits it to a physician office.
St. Vincent's, IU Health, Community Hospital have built workflows around using this database so that we are ingrained right in the system and right in the way of treating patients.
From a patient level, patients expect it. I guarantee you, if you walk down to our emergency department and say, tell me what medications you're on, or tell me what problems or what clinics you've been to, almost the default response from everybody is look in the computer.
The physician can get lab results from multiple hospitals or laboratories from one source.
What we found is that by having the IMPC or the database with all the information, it allows hospital systems to acquire and scale rapidly, so they can buy other hospitals, and as long as they link it to the IMPC, they don't have to do a systems integration or an electronic medical record integration. And that's big. That's very big.
The Beacon opportunity allowed IHIE to invest in itself, to make more connections with hospitals, with physician offices, with laboratories, imaging centers, bring more information in to attract more payers to the table so that the reports became more comprehensive. The more information you have, the more valuable it becomes.
What the Beacon grant did was to give it something really remarkably interesting and wonderful to do, and that was to begin to take the data and, among other things, really look at improvements. Beacon made it clear that we were going in a whole different direction, and that federal policymakers were determined to show what was possible if you really had good information and could use it well. That's really what Beacon does. It was a significant grant of money, and that helps because you're able then to really build up the structure and the competencies and expand. In IHIE's case, it also allowed IHIE to expand more quickly and to add more hospitals to the system and the network, which was essential for its success.
The next step is, let's take it elsewhere.
Indiana Health Information Exchange, this is Jane.
We've actually got the connectivity to the IMPC down to a fairly good science. We've gone from about a 9-month implementation to about 3 or 4 months now.
I think you're all set.
We've figured out the governance part, and I think it sounds simple, but when you sit down to do it, it's not as simple as it sounds, but we've been there, we've done that, we know the conversations we have to have, and I do think that that's a piece that has been really underestimated by other communities that have tried HIEs and have failed. Because if you don't get that right, how do you bring competitors to the table?
The insistence from the beginning was having a business model that worked. And when it comes time to really scale that, your partners want to work with someone who has already figured out how to make the thing sustainable. IHIE is no longer Buck Rogers, it's no longer the future. This is the way healthcare is now provided. And to have a system that's as provider friendly as IHIE has always been is exactly what people want.